Well, let's go ahead and get started, everyone. We've got many more people coming, but we've got a good crew here on time. Let me go ahead and screen share for just a minute here and kind of introduce the evening, and then we'll get started with a very exciting time together. I couldn't be more thrilled than the time we're going to spend together in the next hour and a half. Just a reminder, we want you to invite your friends to our study club, and we have a wide audience geographically, but we want to keep building this, and we will bring to you the very top people in the field of integrative dental medicine and medicine that first Wednesday of every other month. So please invite your friends to come and join us for this experience every month. If you missed us back a month ago, a little over a month ago, we had our IDM symposium, and it was so great. You see pictured here those that were the speakers, and we had a tremendous group of clinicians and researchers, and just an incredible time of learning together for 2 days here in St. Petersburg. And we're going to do that again next year in May. And so be looking for that to come join us. And tonight, one of our really special friends that also participated with us in the symposium is Mark Cannon. Mark and I have known each other for a number of years now, and I can't tell you of anyone that I respect more than Mark in the field of dentistry and medicine. Mark works up in Chicago. He's a pedodontist. He's a microbiologist. He works at Northwestern University Medical School on their faculty there as a dentist, working with the researchers and physicians there at the university. And Mark is just so brilliant when it comes to all things oral systemic. I don't think there's one question I can think of that I could ask, and I have many, that Mark wouldn't have an answer to. Mark also serves with the Nobel Committee, looking for those Nobel Prize winners in science each year. So he's just so highly esteemed by all of his colleagues internationally in this area of his expertise, which is really, I would say, the whole GI system and beyond. And so we feel so honored that Mark would take an hour and a half to be with us. And I hope that you all will be putting questions in the chat room. I know you'll have lots of questions, because when I think of the subject of integrative dental medicine, I think the low-hanging fruit is really the subject of perio and oral pathogens. This is an area that everyone's already working in to some degree or another, and it's very easy to transition into a much higher level of study and clinical practice, whereby we're introducing patients to not only the implications locally of inflammation and infection, but also the implications of their whole body health. And so, Mark, I'm going to exit this right now, but I just want to thank you for being with us tonight. And I'm going to stop sharing so we can just see each other here.
Well, thank you so much, Whit. Thanks for the great introduction. I'm a professor at the Feinberg School of Medicine, and I teach at Ann and Robert Lurie Children's Hospital, and I'm head of the pediatric dental research there. I'm on the Comprehensive Cancer Research Center, all that, but I was just part of the Nobel Assembly, so I didn't get to pick anybody. The Nobel Committee is all Swedes, and the Nobel Assembly has the non-Swedes on. So I would have to change my nationality to be actually able to pick anybody. So that's a big change to do. So I'm not sure if I'm really ready to stand in line again like I had to during COVID to get my license, my driver's license upgraded.
I'm with you. Well, I wanted tonight just take advantage of this time, which is so precious with you, and to let's go through, and I kind of entitled this session together of leaky gums and leaky gut, a term that I hear Laura mention a lot, as well as Gina Pritchard. But I'd love to talk with you about that. And Laura, you jump in, and anyone else, if you have thoughts, please just enter those. Laura, could you kind of monitor the chat and just chime in with anything, and others can speak up. But Mark, as we are learning about oral health at a much deeper level, and it's the irony, isn't it, of we've for so many years known that bacteria can cause potentially bacterial endocarditis in high-risk patients with heart issues, and that we should pre-medicate people that have hip and knee replacements, for example, because we recognize bacteria can get into the bloodstream and go to these different sites. But yet, I would say, and I don't think I'm overestimating, 99% of us in the dental field, if we got a letter from a hospital or from a orthopedic surgeon saying, your patient, Mrs. Jones, is about to have knee replacement surgery, and we need to clear her for any dental infections, and we need a letter from you before we proceed, that the average dentist and the average dental hygienist would have no clue what to do next, except to say, well, she comes in every 6 months and her gums don't bleed too much.
Yeah.
So,
it's interesting you mentioned that, because again, my history going back to the 70s at the hospital is being there. We were always being called for consultations and to clear, and it would be always a very extensive examination and always a discussion with the transplant team, whether it be a renal transplant or whatever, the overall condition of the oral health. Now that goes back all the way, as you know, to Ramses II and the Battle of Kadesh. And afterwards, the Egyptians commemorated the capture of some of the Hittites by having these murals that you can go see in Egypt, where there's these captured Hittites on their knees like this, with their mouth wide open, with Egyptians behind them with spears, because they wanted to see what their oral health was, to see what health they would have to be a long-term slave for the Egyptians. And the Roman historian Tacitus mentions this. So this stuff has been known for thousands of years, literally thousands of years, that oral health is a very strong determinant of systemic health. So it's not anything really new at all. And doing the full consultations were something that I just cannot assume that everyone did. But the whole issue of this goes all the way back, because we've had periodontal disease since the Mesolithic period. And so that's why mummies show a tremendous amount of periodontal disease. The first bridge that they know of was done on a mummy replacing lower incisors that were lost due to periodontal disease. So this is nothing new. This is something that has been around. The first restorations were found in Tuscany on fossils, some fossilized teeth that had been prepared and restored. And that was from about 12,500 years ago. So that does mean that dentistry is the second oldest profession. So I guess that's where we have to start. We have to start back at the beginning and look at things from an anthropological standpoint. And you know the theories about how we got to have periodontal disease, and we unfortunately share it with dogs, because, as you know, we domesticated them, and they first joined us as proto-wolves or proto-dogs, and on our mastodon hunts, and then we would share food with them and share the meat. And we shared DNA plasmids from Porphyromonas gingivalis, where they're Porphyromonas gilli. And then we got the superbug right now, PG, which is the ultimate keystone pathogen. You know, with the FIM-A different phenotypes, you know, FIM-A type 1, 2, 3, 4, 5, 6. And type 2 and type 4 being the particularly virulent ones that are causing all the issues that we see in our patients. And I think it's important when we go back and look at that we look at it as being one disease and not one separate disease. As you know, I was a little controversial a few years ago. We suggested changing the name of periodontal disease to calling it actually a simplex or a complex, because of the fact that periodontal disease is there along with atherosclerosis, along with inflammatory Alzheimer's. Which makes testing so important, because you can actually have a lot of systemic disease and have someone who's relatively good with their periodontal status because they didn't used to be good with their periodontal status. Yeah, that's the old story about, the umbilical artery. Given time, as you know, porphyromonas gingivalis is associated strongly with preeclampsia because it colonizes the umbilical artery. And in given time, you would have atherosclerosis with that artery too, but pregnancies don't last a number of years. Thank God. In fact, I have one of my daughter-in-laws in labor right now. Yeah, I'm going to have a new grandchild by tomorrow, another granddaughter, and my youngest daughter is in contraction. So thank you so much, Amy. So it's kind of an interesting evening.
Oh, boy, yeah. You need to leave.
Daughter-in-law and daughter both having they were due like within a week. So it's interesting.
That's tremendous. Well, I won't ever forget that, because we're due on Sunday. We have a grandson coming on Sunday.
Oh, congratulations. How many now?
Or so. And so.
How many?
That'll be 3.
3? Oh, I'm so far ahead of you, dude. Well, I got 4 and 5 coming.
That's because I'm so much younger, Mark.
I know you are. Yeah, you're so much younger.
Okay, Mark, back to these. You mentioned the word keystone pathogens, and I know Tom and Laura talk a lot about that. AAPG, TFTD, and FN. Would you kind of talk about each one a little bit? Because when I hear you talk about this, it's like they're your next door neighbors, so well. And most of it.
No, not really, because, when I got started off, we were studying Bacteroides melangenicus 25261 a lot, which is now Prevotella nigricans. That was my original research. And we misunderstood. We thought that, in fact, my paper from 75 was on the role of phagocytosis of the initiation of autoimmune disorder. And that was totally incorrect, because it wasn't phagocytosis. We didn't know that Prevotella nigricans was also an IBP. The key thing about many of these pathogens is that they're IBPs, intracellular bacterial pathogens. Porphyromonas gingivalis is the most famous of them, because as IBP, it goes into all the epithelial cells and your immune defense cells, like your macrophages. When it goes to the epithelial cells, it epigenetically turns off the tight junctions, which allows all sorts of leaky. You were talking about leaky gums, leaky gut, but it continues. Leaky blood-brain barrier, because it does the same thing, shown very well in research now, just the last year or two, on the endothelial cells in the blood-brain barrier. It opens up the blood-brain barrier, but it closes it to the defense immune cells. That takes my breath away. So it opens it up to all these other cells, including commensals, but closes it to tissue macrophages, which means only your microglia are there. And the microglia are kind of like rampant warriors. They often will trim things you don't want trimmed when it comes to neurons. So that's an amazing advancement with that. Of course, Fusobacterium nucleatum sets up everything too, being part of the yellow-orange complex beforehand. And of course, Trapetima denticola is that nasty little spirochete that likes to go into every one of those cells. That's the one that looks kind of scary in the microscope. But they all have very important factors that they have, or functions, like Agretigobacter actinomycetes is one that really strongly influences the immune system of the host. So they all play little interesting roles, with AA really affecting the immune system. That's why having the proper commensals to get rid of the AA, which would be a lot of your strep oralis and strep uberis, because they're hydrogen peroxide producers, can affect everything. It is the strangest biofilm conundrum going on. You're in Neisseria, like Neisseria mucosa, which is a very important commensal that breaks down nitrates to nitrites and is very important for nitric oxide. And nitric oxide is extremely important as a chemical messenger for a multitude of things. Back in 1998, there was 3 Nobel Prize winners, and one was Murad, who was at Northwestern and then went on to Houston. The other one was Ferchgott, and Ferchgott, Ashley Murad and Ferchgott got the a special award at Northwestern, the Askers Award, in 1997 before they got the Nobel Prize. And Ferchgott was a faculty at Northwestern for 10 years. I mean, it's a strange small world, right? These guys who worked on nitric oxide. And what they showed is nitric oxide is responsible for cardiac repair, capillary dilation, the prevention of memory loss. Mm-hmm. People forget this all the time, that these bacteria can cause nanostrokes and microstrokes that are very hard to see with MRI, but will cause changes in brain by causing brain atrophy. And they do leave behind some little marks. I mean, just like Porphyromonas gingivalis and the gingipanes, you can find the gingipanes actually in the outer membrane vesicles of Porphyromonas gingivalis. Another little cute thing about PG, they have these little outer vesicles loaded with gingipanes. And these gingipanes actually attach to help open up the cells and open up the tight junctions too. And they're very pro-inflammatory. Now, PG, fun enough, goes into the macrophages and takes over your macrophages. And at first, what was the big theory about that? Well, it causes increase in nitric oxide, which doesn't kill the PG like it's supposed to, because the PG is all IBP at that time. It's all within the cell. But it does cause growth of more blood vessels, causing your periodontal tissues to swell, and that's why you get swollen gums. So you get the swollen bleeding gums because you have all these extra capillaries because your macrophages have been taken over. But here's a crazy theory that just came up maybe about a year ago. The PG rides in the macrophages to other parts of the body. Wow. Again, that's one of the things that just kind of like takes your breath away. You go like, what the heck? How'd they evolve to do that? Then you think, well, of course. Back in 2007 in Pediatrics, they had this wonderful article on maternal imprinting where commensals were picked up by monocytes in the mom's gut and taken to the breast to be taken alive to the lactating glands so that the mom can produce a breast milk that has commensals. And that's why breast milk is loaded with good bacteria, right? That's one of the most important things about breast milk is the load of bacteria. And the human maternal oligosaccharides within breast milk are all there to help feed those bacteria. So we can go round robin, and we see how the body evolved. Then we see how the pathogen hijacked that capability for its own nefarious reasons to then be able to transport itself to other parts of the body. That's why when you've seen the famous studies that were done like by Sidney Feingold and others, where they looked at biopsies of different tissues and they found the lipids, the fats, like the phosphorylated dihyroceramides from these pathogens present not just in gum tissue, but also within arteries and also within the brain. And of course, circulating PDHCs are biomarkers for insulin resistance and then for diabetes and also for obesity. So you have all these things coming around from these pathogens, which all have these unique little features in them a lot of which have to do with circumventing our immune system. And with Fusobacterium nucleatum, it not only produces a lot of inflammasomes, but it's also oncogenic. And so you end up with the oncogenicity of it in converting adenomas in the colon into adenocarcinomas. So that's how you get a lot of your colorectal cancer. And how does that happen? Well, it happens because, sadly, antibiotics contribute heavily. The very famous Queen study out of the UK, where they looked at 500,000 individuals, and they compared and found that history antibiotics was very significant in the development of colorectal cancer. Just like many cancers, history antibiotics. And it was so specific that certain cancers are produced by certain antibiotics. So you can have like colorectal cancer of the proximal colon, and it's related to like penicillin and ampicillin and amoxicillin. And then oddly enough, doxycycline is protective because of the effect of our commensals. The good bacteria often prevent inflammation. The lactobacilli are famous ones to prevent inflammation. So the last thing on earth you want to do is kill your commensals. You want to leave your Rothia genus alone, Neisseria alone, the lactobacilli alone. And there's many, many good streps, which is very important.
Tell us a little bit about what you do with children. I mean, we understand that these are contagious pathogens shared among family members, and you're treating children who may have periodontal disease in their family history. Give us some thoughts about that, if you would.
Well, first, a couple studies. There was one done in classrooms, and they found that you actually could find little agglomerations of kids prone to decay, depending on where they were sitting in the classroom, because of sharing snacks and stuff going back and forth, borrowing pens that they all had, put their fingers everywhere, and they were passing strep mutant strains amongst each other. One of the best studies ever on perio was one where they did some deep sequencing, and they had this family that had severe perio. It was done in Brazil. I think it was in Sao Paulo, University of Sao Paulo. And they traced it back because they could actually, even with diagnostic testing, they could find that strain. It was a good study, really good deep sequencing one. In the kids in the family, and then in the parents, and then also in the grandparents. And then someone said, let's test great grandma, who was like in her 90s, and she had it. So they decided to see how this would happen. Do you ever hear about this? This is incredible. So being good Portuguese and being good Portuguese Catholics, they always get together after Mass at great grandma's for pasta and a sauce. The great grandma had the special recipe too, and she had this wooden spoon. I'm not making this up. And she would sample the pasta sauce. I love the Brazilians. I've been to Brazil quite a bit doing research, and I love their family units are so intact compared to ours. But they would actually, she'd sample it. It was her, even though she was edentulated, somehow she still carried it. Which is something that is interesting, because just because you edentulate doesn't mean you don't carry it, because it's elsewhere in the body. It's already, throughout a lot of the body, including the brain. And of course, it's in the gum tissue, even if you take out the teeth. You just won't be able to test it so easily. So she was managing to transmit it all the way down through the generations. They were actually able to trace the generation diversity, the MLST, showing it came from great grandma. I thought that was fascinating. But going back to kids, best therapy is always prebiotics and probiotics, not just for oral health, but for all autism studies that have come out. There's been a slew of autism studies recently on prebiotics and probiotics, and the Journal of Psychiatry had a wonderful one, and the Journal of Medical Microbiology just had a wonderful one on prebiotics and probiotics. And we did our research with prebiotics and probiotics, and we showed the best effect was really on prebiotics and probiotics. Postbiotics, that's a different story. That's the metabolites, and we can get to that later. Because the nice thing about prebiotics is you set up the field. And the probiotics, once they populate, then you'll get the postbiotics and all the translational effects. The idea is if you use a probiotic, remember, it's got to be for 60 days. Mm-hmm. And this is from research that was done way back in the 90s, that it takes about 60 days to have good population. By using the prebiotics, you make sure they have actually an effect that will be long-term. Now, our study that we did at Children's, that I was the lead author on and the principal investigator, with kids with probiotics, we did a 3-year follow-up and they were still showing the effects, but we did not actually do any deep sequencing or anything like that on them. So I can't say if the microbiome was totally still affected, but they were still having a positive effect with a much reduced caries rate. So that's something that's very important. As for periodontal disease, the average onset in the UK is age 16 to 17. So we do see it actually all the time in our practice, especially in the orthodontic patients, and especially in the orthodontic patients who are on a lot of medications like Vyvanse. And if you see someone who comes in with massive amounts of decalcification, the tissue looks terrible, and they're 12, 13, 14, 15 years of age, go back and ask the parents again, are they on Vyvanse? Because Vyvanse will give them meth mouth. It's something that is really very important. Capsule versus like yogurt. I love kefir. I always used to call it kefir, but my Russian friends have corrected me, and I'm afraid if I don't go by what they say, they'll invade me. So I go what my Russian friends say is kefir. I love kefir. I think it's a very good way because you're getting your probiotic and the prebiotic. In this case, it's a GOS, galactolignosaccharide at the same time. So that's absolutely true. And by the way, there's a new patented prebiotic that's a form 11 that's coming out that will be excellent for gut health. Just absolutely excellent. I've seen the research, and so it's not published yet, but it completely repletes your Akkermansia muciniphila. Amansia is a second generation probiotic. I do say, sadly, there's only one company with it right now who seems to be having a hard time keeping up with the demand for Amansia. The FDA only wants Amansia to be done as pasteurized, but they're producing a live version of it, which I think is wonderful. If you take a live version, you have a chance of repopulating. Go for 60 days, you should be repopulated by that time. The companies don't like to tell people, by the way, you can do our probiotic for 60 days and quit for a while because their sales would drop. So I never said that. I deny. Please erase this tape when we're done.
And so as far as probiotic on children, are you using tablet form that they dissolve like at bedtime, or different?
Yeah. That's what I've been using. I've been using those for a long time. I got first started with BioGaia back in the 1980s. I was at a meeting in Europe. I came back with some and I ordered it, and I got it through Everidis in St. Louis. And then when ProBio Pro came out, I started to use that too, because Jeff Hillman was always a hero of mine. Mm-hmm. I've told him that personally, that, I go to these meetings and research meetings in the 70s and 80s, and I would go hear Sokransky and Hillman and Johnson and others from Foresight. And Hillman talking about, Jeff Hillman, about a bacterial replacement therapy. He was so far ahead of his time. I loved it. I mean, that's what we have to do. Don't forget, the average baby born in the United States is short 20% of the microbiome they should have.
I'm going to make you repeat that, because people ask all the time, well, we have these, don't we just have these? So I want you to make that statement again, because I talk a lot about imprinting. Were you imprinted good or imprinted bad? So I think as a community, we need to hear that instead of assuming that everybody's coming out with everything that they need. So say that again so we can really dig.
I have to be very, very explicit with this. they have done beautiful studies on this. I mean, the Burkina Faso study comparing the kids in Burkina Faso published in PNAS to kids in the EU. The kids in the EU were completely missing a whole genus of xylobacters. They cannot process the cellulose like they should be able to, the xylans in a lot of foods. And that puts us at a great disadvantage because it makes us eat higher calorie foods because we don't process the really good roughage like we should be able to process. We're more like an elephant. We poop out most of the good stuff still. We barely break it down. That's why monkeys eat elephant dung, right? Because it still is full of nutrition. But I wouldn't recommend that, by the way. Okay. I'm just kidding. I'm just having fun there. But anyway, going back to that. So the famous Hadza study where they compared the Hadza hunter-gatherers, they have, again, we're short about 20%. We're really short a lot of bifidobacteria. We're short a lot of strains of Bifidobacteria infatis, which is very important for development of the immune system. And that's why we have so many immune issues. And number two, breastfeeding should be as long as possible. And it should be, as a society, we should be doing everything possible to make it possible. I mean, I used to say that back when my oldest, who's like, what, my God, he's 38 or something, almost 40, back then, breastfeeding is so important. And you got those oligosaccharides, you got all those, it's loaded with bacteria. But people aren't getting it because their parents are shorted. The mom short it, and the mom's mom will short that. And we would find that with all the gluten metabolizers, like the Rothia. Again, the Rothia genus is loaded with good bacteria. They were actually in 2011 published by Foresight. They isolated the Rothia genus. They isolated out Rothia area, Rothia mucilagiноsa, Rothia dentacariosa as being very important bacteria for breaking down gluten. But they also modulate your immune system. So we have a lot of people with gluten sensitivity. Now, there was a beautiful study. Was it done by Byrne? I'm trying to remember who published that. It was published in the British Journal of Nutrition, though. They compared first-degree relatives and people with celiac disease to like the brother who did not have celiac disease. And the brother could eat pizza and drink beer, had the gluten metabolizers, whereas his sister, who had all the symptomology, could not have those products. And you have to remember that back during the Roman Empire, even Egypt, ancient Egypt, the staple was bread. And the Roman legionnaires got bread and salt, and they got some salted pork and stuff like that. And they also had some type of bean or pea, if I remember correctly, but they conquered the world on that. Although the bread was very special, Rome, you had to have the emperor had to give you a license to make bread in Rome, and they only had 300 of them. So if your bread wasn't the best, you lost your license, which I think is hysterical. You can only imagine the corruption even back then, right? It's like in Chicago, I was talking to someone about corruption. He said, yeah, my family, we had a bar in Chicago. Corruption. I go, I know. You get these special inspections. You have to take the cash out for the inspection always. So yeah, we're missing a lot of bacteria. And here's the problem. How do we bring them back? And that's where fecal transplants come in. As you know, just a month ago, I think it was just a month ago, Voust was approved, which is a capsule. That's a fecal transplant capsule that you can take, and they have it allowed now for C. diff. And of course, the National Institute of Health and the Cancer Institute, they want to use it now also for cancer treatment. Because as you know, whether or not you survive with cancer therapy depends on your microbiome. Beautiful studies have been published on that, whether it's breast cancer or pancreatic, especially pancreatic cancer. Common duct pancreatic cancer, there are a lot of special fungus that are involved. And of course, one of our old friends, Porphyromonas gingivalis. PG is involved with pancreatic cancer, just like PG is involved with oral cancer. And what else is involved with oral cancer? Strep mutans. Now, here's an interesting story. Strep mutans produces mucosins, right? That kill other bacteria. Mucosins are like it's a bactericin. It produces mucosins, and that kills your Strep oralis. That produces hydrogen peroxide that kills your Porphyromonas gingivalis and your Fusobacterium nucleatum. But the mucosins also kill your Neisseria, like your Neisseria mucosa, and produce the nitric oxide. So what keeps, like they've done studies on this, what keeps Candida albicans from attaching to your epithelial cells? Nitric oxide and beta defensins. But nitric oxide enables the innate immune system, just like xylitol does. It increases the effectiveness of your innate immune system, and it increases the effectiveness of hydrogen peroxide or reactive oxidative species, like xylitol does. So it defends Candida albicans. And Candida albicans, I'll say it, Candida albicans, if it was Canadian B, Candida albicans, okay, but okay, I'm not in Canada, so I'll say Candida albicans. It forms a superassemblage with strep mutans. And what is one of the most oncogenic organisms in your mouth, in your body? Candida albicans, because it produces acetaldehyde at mutagenic levels, but not in the presence of xylitol. This stuff, you couldn't write a script like this. If you were to write this as a series, like Lost in Space series or something like that, no one would believe this script, because what happened was all these different organisms formed allies and natural enemies. I always describe it as Chicago on Memorial Day when the gangs are all fighting. You see the horrible deaths that happen. And there's all this collateral damage, which is terrible. These poor kids who are shot and killed. And the gangs fighting for influence and for territory, and people trying to gain their status in a gang by doing more carjackings or doing more hits. Our pathogens are like gangs. They fight for territory, but they form allies. And this is why our allies are our commensals and our probiotics, because they're there to defend us. And our probiotic allies, they need the prebiotics to help them out, whether they're the FOSs, the fructooligosaccharides or the galactoligosaccharides, whether it be your artichokes, your asparagus, whatever, they need their allies too. So it's a catch-22. You need to have the diet and the microbiome. But if you don't have the microbiome, the diet's not going to help you as much as if you had the microbiome. You can have the microbiome, but if you don't eat the right diet, you don't get the benefit, and eventually your microbiome will change. The thing we have to avoid are the antiseptic mouthwashes. I think that the one article that came out in Intensive Care Medicine, Journal of Intensive Care Medicine, was followed. I mean, it followed a number of other articles on what happened with the ICUs. If you want to read about the microbiome, the oral microbiome, read about the ICUs. 2012, 2011, they started to do a lot of chlorhexidine because people postulated that if you did a chlorhexidine mouth rinse before using ventilator-assisted pressure, they would actually reduce the number of pneumonias. And at first that appeared to be the case, and that would actually make sense. It would reduce the pneumonias that would happen. But they started to have these studies come out showing like what happened to the mortality rate. It went up. A study in 2017, another one in 2018 that was in like 80,000 patients, 11,000 of which were on chlorhexidine compared to the other 68,000 that were not on chlorhexidine. The death rate, after they took out all the confounders, went up in the chlorhexidine group. And they're all saying, oh my God, we forgot to listen to the American Heart Association, which said, don't kill your nitrate reducing bacteria. because you significantly increase the blood pressure, but you also significantly decrease the ability of the body to heal. You decrease respiration because you're constricting. It's like when they put people on 100% oxygen, you never do that, right? A burn victim always gets carbogen, which is oxygen and carbon dioxide, because once you get 100% oxygen, what happens is you actually cause vasoconstriction. That's what the body does. That's why you use carbogen. I was so upset when all this stuff was going on when COVID hit, because I said, this is going to be a disaster. We're going to be losing people in the ICUs. The United States is going to have a terrible death rate compared to the country. Said, don't do this. So yeah, our case adjusted rate was 0.9%. The countries that did not do it had a 0.2% adjusted death rate. So it was a big mistake. There's still articles coming out. They're blaming the 90,000 excess cardiovascular deaths from March of 2020 to March of 2022 that was reported in cardiovascular research on the overuse of this, explaining how you cannot mess with Mother Nature. Besides, all the studies with like chlorhexidine orally shows that you do affect the microbiome positively for 2 to 3 weeks, but after that, the effect goes away.
Well, that's something we talk deeply about is, right, none of these chemicals were really created for any type of chronic long-term use, right? It was for short term. You had ANUG, get them on it for a week or something and get back when we could see you. And somehow in our industry, we've created this billion-dollar business with all these antimicrobials. You started talking about this, and you yourself did an amazing study where you actually showed the use some of the most common antimicrobials with some of our keystone pathogens, but even talked about like that, our healthy nitrate reducers, especially our Neisseria, Raffia. Just speak a little bit about that. I think it's great research for us to understand. I feel that was so well done in our community for people who are like trying to grasp what you're saying. I'm sitting here nodding my head, but there are some of us who like, whoa, I've never heard this before, right? I've been told my whole hygiene or dental career, we've been focused on killing, I say, and not creating health. What we're talking about, how are we actually creating health, preserving health, returning, re-imprinting to health? Can you just speak on that study? Because you do have some great lists in there showing what they do to specific species for us.
Yeah, sadly, we found that there's a lot of products in the market that strongly inhibit our probiotics. And we looked at a number of very important probiotics, for instance. And you have to be very careful with some of the research, because they'll say like, oh, we killed a lot of strep species. You go, yeah, your product killed the strep oralis, the strep uberis, and even worse, the strep salivarius. And again, another great study just came out on strep salivarius as being this super wonderful bactericin that kills strep pyogenes and strep mutans. So we're creating strep throat in our kids by killing off the bacteria that prevents them from having strep throat. Now, we've known about that, says Stan Schulman, who was head of SID, Special Infectious Disease, at Children's Memorial Hospital in Chicago, discovered it, 25, 30 years ago? I sometimes I'm just amazed. I have a funny story about that. I know you probably heard this, Laura, but the guy who ran the SID lab called me up and said, hey, Stan Schulman dropped by the lab, was walking around, and he looked at back in the deep freezers. He goes, whoa, where we get all these strep salivarius, M12s and K12s and M18 strains from? They go, oh, Mark Cannon brought them in from New Zealand. And he was laughing so hard, going like, wow, I wish I had those back when I was doing research. He was one of the most brilliant researchers on the planet. He still is an idol of mine. But yeah, we have done that with a lot of the over-the-counter products. There was a number of over-the-counter products that were, even from Crest, that were killing a lot of our most positive bacteria. Because remember, we evolved with these guys. They've been with us forever. Lactobacilli rhodori is in cattle, pigs, chickens, by looking at the evolution of it, they postulate it goes back tens of millions of years to the dinosaurs, to all the vertebrates, because it seems to be in all the vertebrates. This is a very important modulator. If we die, they die. They don't want us to die. We're the cruise ship. We feed them. And they're like my old analogy on this are commensals. We're a cruise ship. Our commensals are our passengers. Our probiotics are the crew because they help us a lot. They feed us. They break down a lot of the food for us. They break down the gluten for us. They break down all sorts of things. They produce our vitamin K. Oh, for God's sakes, they do so much stuff for us. Unbelievable. And then every once in a while, we have a pathogen who's a pirate. We get the pirates coming on board and they can take over everything and really mess everything up for us. So, and I saw some comments. There's been a lot of stuff published. Sadly, most of the great stuff is published in microbiology, like Journal of Medical Microbiology, Journal of Oral Microbiology. JAMA will have great articles. Gut will have great articles. The British Medical Journal has great articles. The British Dental Journal has a lot of great articles. I think the key thing going back, I mentioned back with nitric oxide, was memory loss. And the British Dental Journal, when they did their evaluation of all those thousands, tens of thousands of people, and again, taking care of all the confounders, which they can do because they're the National Health Service. They have all the records. They can use AI, clean right through it, pick out all the anomalies. One of the major things they found with periodontal disease was mental illness, because we got that leaky blood-brain barrier. And now we have the issues that we're finding too with the microbleeds, which sadly, I bet you you've had family, I bet you we've all had family members who've had that issue. Yeah, and we just didn't understand it. And strep mutans can cause, strokes and everything else. So strep mutans is really bad. So going back to the kids, I do the prebiotics. I mean, you can do everything. We have a toothpaste that has a prebiotic in it, xylitol, also has L-arginine, also has a remineralizing nano-trimetaphosphate, and also has fluoride. Why not use the toothpaste that completely positively affects the microbiome and remineralizes not just the surface, making fluorapatite, but does deep remineralization? The trimetaphosphate goes way deep in remineralization. The products are out there. The problem is that these companies, they have it like the patent on trimetaphosphate belongs to a university, and they're not going to go out there and spend a lot of money on marketing. And it's all about marketing and the money you have for marketing. And of course, with probiotics, we're just beginning on the probiotics. I mean, we got the oxalobacters and everything else that'll be coming out. The Pediococcus acidilactic, which actually repairs your atherosclerosis. I mean, I cannot wait for the second generations, which will be there actually healing the atherosclerosis, and lactospericide, which actually will be taking care of the high cholesterol levels, because they produce cholesterol dehydrogenase and break down the cholesterol for you in your gut. I mean, it's way past time for us to be looking at this. But if you have a mouth dysbiosis, excellent chance you're going to have a gut dysbiosis, right? Laura, you know this. We've all said this 1,000 times, that you swallow 1,000 times a day, right? We have 20 billion bacteria any one time in our mouth, and we end up with 100 billion bacteria swallowed every day. So if you have a lot of pathogens in the mouth, you have a lot of issues in the gut, because the pathogens affect more than a few of your strains. Right. Our research showed that with prebiotics and probiotics, we were changing about 600 different strain shifts with each one in our normal and also in our autism populations. That's a lot of strain shifting, because they all have niches. Right. Strep mutans really needs Candida albicans to cause early childhood caries. Without it, it doesn't happen. So that's why doing everything completely and preventing cavities in kids may later prevent cancer and a stroke in them too.
Well, I love that you say that, because I know if Dr. Pritchard was here, she would just want to chime in that, you know, even though we say leaky gums is leaky gut, she always says it's the leaky syndrome, because it's everything that you're talking about. It's every lining of the body, whether we're going to talk about the kidneys, the liver, the brain, the heart, it's every organ. For our community out there, I just kind of want them to kind of pause, get some of these questions I do want to answer, and then just bring it together. We've been talking about, I know we wanted to start in the mouth, work our way down. I love to talk about pregnancy and things with you, but I really just want
yeah, during pregnancy.
well, but I
want to pregnancy. Oh my God. This is to me one of the most exciting things, because I'm so sorry, you got me excited again. With bacteria,
microbiome controls everything. We speak a lot about that, right? Once you get in dysbiosis, it's like you said, it's a war. You know, we're fighting bacteria with bacteria, but we're not just talking about bacteria. Bacteria is controlling the yeast, the fungus, the virus. Like that's
right. Yeah, it's a whole biofilm.
Yeah, it's a whole, like I call it ecosystem there going on. And we have to understand that the major players, like you said, are going intercellularly. They're controlling that. They're like at the front. And that's why we look for those 5 because of that. But I want to get to what you're excited about. I don't want to hold too much off there, but so let's dive into that. I know Dr. Neighbors is on here. It's one of our big passions, as well as with IDM, to be bringing these type of topics to the community, because like you said, it's so important. So lead us off. Yeah, go ahead.
In fact, I just shared this article yesterday with Kirsty Argard, who's head of maternal fetal medicine at Baylor. You know, Kirsty's one of these great researchers, and she studied about 9,000 pregnant women in Malawi, and half of them got a xylitol gum and half did not. And they were randomly assigned, and the end effect was much less periodontal disease, and the half that got the xylitol gum, which is to be expected, because in 13 out of 14 chewing gum studies they showed that, right? Much less porphyromonas gingivalis and so on. 5 out of 7 big clinical trials showed the same thing with xylitol gum on periodontal disease and inflammation, but the low birth rate was reduced. The occurrence of it, and there was a very strong preterm birth was greatly reduced, and there was a very strong trend toward a reduction in miscarriages. But the other main thing is the babies could feed much better, which they were really surprised. I'm not, because the mom had a normal microbiome, which meant the baby was getting the right type of bacteria to break down the food that the mom was giving the baby. I mean, it all makes sense when you know about microbiome. The article I shared was that you could predict issues in pregnancy by the level of Neisseria orally and the level of the nitric oxide. Not just have they done studies showing that low levels of nitric oxide are associated with low birth weight babies, and that normally during pregnancy, your Neisseria are supposed to go up in population and your nitric oxide is supposed to go up. And the blood pressure actually goes down for normal pregnancy, because that's how we evolved. It all makes sense that way. I don't care how you want to paint the picture. It was planned that way, okay? It was planned, period. It's not accidental that this occurs. So on the other hand, if you let the strep mutans grow, it kills off the protective commensals. You also lose your Neisseria, and that's dietary driven, a lot by people snacking a lot of sweets during pregnancy. And you have an increase in the rate of preeclampsia. Also, if you have PG, a higher increase. So it all plays together, right? Totally. But now we throw airway in.
Yes, let's go there.
Now with airway and pregnancy, it's to me shocking. And there's not one woman who's pregnant that should not have a very thorough periodontal examination, who shouldn't have full testing for all the pathogens, but also airway evaluation that includes asking the spouse, is she snoring? Because the studies have shown a very strong connection between snoring and cesarean delivery. snoring, and gestational obesity. And you have hey, Holly, I like your cat, by the way. I see your cat up there. I see the tail waving back and forth all the time. And also the difference between a chronic airway issue and just acute one that occurs during pregnancy, because during pregnancy, some women gain weight. And the fact is that there's more of an issue with airway. But here's the beautiful thing. What a great time just to treat it. Because you can do an airway appliance. You don't care if you lightly just bring the mandible forward for a few months during that third trimester. Do you? The first trimester doesn't matter. So anyway, it's really something that I think we need to look at, because what they have shown that this intermittent hypoxia, they only know this from animal studies, that the intermittent hypoxia during pregnancy that can happen second and third trimester can affect brain development strongly, even though it's just intermittent. And as a practicing, and I'm just retired again, right, for the third time, retired, they keep bringing me back to work. So retirement becomes elusive. But they have shown that this brain effect occurs, which makes me wonder about all those kids I would see, because I had a specialty practice with a lot of kids with special needs that were like learning delayed, developmentally delayed, learning disability, sensory perception issues. How many of these kids were because of intermittent hypoxia? Because no one's been looking at it. Now, Takashi Ono has all that great research, of course, on jaw development, fetal jaw development. And one of the things I also see a lot are babies coming in who cannot breastfeed, right? They got lip ties, tongue ties. But a lot of them, it's not such a bad upper lip tie, but they're very retrognathic. I mean, you have like no mandible at all. And you're like, how the hell did that baby develop without any mandible? You know, my head looked at the dad who's like class 3, going like, hey, what's going on here? Wondering what's going on in my mind, saying this doesn't make a lot of sense. So just a minor, not even minor, but I mean, it does have to be a pretty good size. Upper lip tie will actually cause an issue with feeding. And so you zap with a laser, there's no problem. But Takashi Ono's research shows that the mandibular development is affected by that intermittent hypoxia during pregnancy. Wow, that's really interesting. Now we know what's going on with facial development. Because I've had parents come in who are like, you know, mom and dad are both orthognathic and the kids are severely retrognathic and adenoidal facies. And I was kind of now wondering, was this something that we missed because we're not asking the right questions? So I'm just asking everyone to just think about that as a possibility. I think the most important time, obviously, are the first 1,000 days in a child's development. That's why so many countries have 1,000-day projects, the 3-year projects in child development. So I really think that this is something we need to absolutely be on top of and need to join in. So that's as you know, on airway too, the main thing on airway for adults is that if a mouth breather gets perio treatment, their success rate of the treatment is half that of someone who is more normotypical.
Yeah, that's one of our big mantras, from airway to pathogens to plaque. So to kind of bring it together wherever we're talking plaques out of the body is, but just starting at what is the root cause, kind of what you're saying now, even going back in utero to these children, looking at, I say all the time, they could just be desaturating. They could just be having hypoxias. We're not getting the oxygenation. And then couple that with the whole imprinting issue. You're not even getting the good species that you need to come out. And that has everything to do with what we're just talking about, vascular function throughout the body. I mean, you're just starting to compound these effects, I say, on, you know, this amazing system that we have, that just, we need to give it what it needs, back what it needs to function. But I just kind of want to bring that in. We talk about desaturation, becoming acidic, right? And shifting from aerobic to anaerobic bacteria. So that's all these loss of these healthy species, right? And in that process, we see the yeast, we'll see fungus, we see our strep mutans, right? And we eventually see this maturation, I say, of these keystone pathogens. And that to me is just this cyclic process that we see going on, that we've been trying to really, I say we have to interfere in that cycle, that we have to shut down. How do we actually shut that down? And you've been speaking of a lot of the ways. I want our listeners to be, I know people are taking notes, but just hearing from the prebiotics, you were talking about xylitol. We say a lot that xylitol is a prebiotic. It not only shutting down decay, right? It's helping us with a lot of those strep strains that you referred to. I say our ear, nose, and throat. Yes, those are all strep strains, whether you get an ear infection, right? A nose or nasal issues that a lot of these kids have, but they also get strep throat and they also get cavities. I want to make sure our community is following along with that. And that maturation, as we see go on, is they continue to even desaturate. It's like a progressive formulation, I say, that we see happening. You see it in these young children, but to be able to follow that through of why you're saying, hey, we need to catch it in the mom, we need to catch it in our adults, we need to be looking at the children, the effects that it's having. There are some questions. I know we were talking about gut and GI. I think there's so much that we can get into, but one of the questions I'm going to kind of come back up, I think, was from Holly, because you mentioned her cat. So I was going to go to that, Holly.
Yeah, cats have periodontal disease too.
So be careful.
In fact, in the veterinarian literature, you'll find that they talk about periodontal disease in cats quite a bit. My son's oldest cat, Rick, just had to have a number of teeth removed, perio. It's kind of a cute story. Now, my oldest son, he's a former 101st Airborne officer and served in Afghanistan. And he gave me his cat to cat watch for a little bit. And I got Rick. I go, Rick, you just had perial surgery and extraction, so I'm brushing your teeth. And I would brush his teeth every night. And I gave Ryan, I say, I got his toothbrush and everything. I'm brushing his teeth every night. And Ryan goes, what? How are you getting that done? I go, for God's sakes, I mean, you served up an FOB Wolverine and you're worried about brushing your cat's teeth. Actually, Rick enjoys it. He just like loves the attention. So Holly, I see, likes that. But again, it's the same pathway. It's the exact same pathway with cats. It's the nitrate, nitric oxide pathway they're looking at for cats that like do for humans. The same pathway for periodontal disease as it is for cancer. So in fact, when you test using the CDOT test from Viome, the cancer detect oral throat, it looks at the nitrate, nitric oxide pathway. Very important pathway to always keep in mind. And when you mention xylitol, xylitol is a very strong anti-inflammatory. It prevents adhesion of pathogens to your epithelial cells. They can't get in. And if they do get in to the macrophages, the amount of the inflammasomes, cytokines being produced is greatly reduced. And it reduces the amount of lipopolysaccharides, the LPSs, which are also associated with Alzheimer's. So all this stuff all works together. And did we mention how that evolved by any chance?
No.
Okay. Well, going back to the marine isotope stage 6, which is part of our glacier past, 200,000 years ago. Yeah, someone mentioned about xylitol. I'll explain why. Michael has a question there about xylitol in dogs. And by the way, don't give it to cats either. Going back 200,000 years ago, there was the great throttling of Homo sapiens, where Homo sapiens went down to just about 10,000 breeding pairs, they estimate. And the great throttling occurred because Sahara Desert, Sub-Sahara, remember we were all Sub-Sahara, greatly expanded, all the savannas dried up, everything dried up, and all the predators were being forced into small areas, very small, very tiny little areas of tropical forest were left. And humans had to flee. We fled into caves at the seaside. And we're in the caves, several things happened to us. We lost a lot of our fur. We lost a lot of our fur because we went swimming all the time. We found that if we dove into the ocean, a lot of the predators would not follow us into the ocean. They might into a river, for a little bit, but they wouldn't follow us into the ocean. And we're better off jumping in the ocean than trying to jump into a river full of crocs or hippos, right? So they're in better shape doing that as a survivability. So we started to eat a lot of seafood, and the seafood's loaded with a lot of proteins and amines that actually encourage the growth of a lot of the astroglia and a lot of the stem cells and precursors for neurons. So our brain actually tripled over and folded over a few more times, cerebral cortex, giving us better computing power, which thank God for that happening. It gave us a little edge. Again, we lost a lot of the fur so we can swim better. It thinned out a lot, reduced the drag that we were getting from our type of fur. Our fur was curly, which was not good for swimming. And we ate a lot of tubers, and the tubers were loaded with xylanes and xylose, and actually xylitol. And so our mitochondria actually adapted. And one of the big things we have in our mitochondria is xylitol dehydrogenase on the inside and the outside of the cristae. And the first part of our energy cycle to get to the TCA is we convert NADP to NADPH by grabbing off hydrogen ion off of the xylitol to make D-xylose. And beautiful research going back in the 60s on that. And that's what makes humans kind of different. And then rats. Because the rats went into the caves with us because we would go out and get food from the ocean. I mean, we wouldn't eat all of it. And we wouldn't eat all of our tubers we roast. Remember, we could roast. Humans have been cooking for 2 million years, right? Now, first Homo erectus were like 90% carnivore. Ate a lot of meat because there was a lot of meat we could eat. And as the forest disappeared, there was more meat than there was fruit. So, but then that disappeared on us because we had to compete with all the giant tigers. So then we end up doing the safe thing and eating seafood because a clam will not eat you, nor will a tuber. But if you roast it, if you have xylobacters, you can break it down and get all the energy. And then the rats learn how to live with us doing it. And then after that, the mice. So when we do research with xylitol, we always use mice. Oddly enough, you can give beagles xylitol, and some of the first cytotoxicity studies were all done with beagles inhaling xylitol without any problems at all. But the dogs, being pure carnivores, never develop mitochondria they use for xylitol. So they try to process it in the liver, and their liver can't process it, just like cats. Keep it away from cats too, because they're carnivores. But we're different beings. We did, however, share perio. So for your cats and dogs, don't use xylitol, but use a probiotic. And there is a probiotic in the market for cats and dogs. Actually, there's a number of them. But there's one that my youngest daughter, who's expecting right now, uses for her 2 dogs. So Probiora Pets. And so it's kind of fun to see them with their little probiotic mustache because they like it. And this is, of course, just a story about this. This is not a study, of course, but the veterinarians always talk about how the probiotics work because they see it in the dogs and cats coming into them. They'll often mention that. They'll talk to someone saying, you must be using a probiotic for your dog because the teeth look fine. We don't have to do anything. Yep. That's what my daughter hears all the time. That's what her veterinarian says too. So maybe we'll catch up with the veterinarians. You think, Laura? You think we'll catch up to them one of these days?
We're trying. We've got this community here. I hope they're hearing that. I mean, that's definitely what we're trying to learn, how to create health and maintain health, right? That's the long-term goal, is not only creating health, I say, but then maintaining health. I love that you brought up the mitochondria. There's a lot that we could go into there, but just people hearing about cellular medicine, cellular health, that's a topic I feel that we don't speak enough on, but just that we are touching on it in this community. So they are learning about redox oxidation, kind of going back to our antimicrobial conversation that, right, the host can only handle so much. And
OxFox and everything like that. That's so important. Of course, acetyl-CoA production. If the acetyl-CoA production is incorrect, it's oncogenic, very strongly oncogenic. And, we are sadly creating a lot of our own cancers. Someone said, is it prudent to change probiotics every 60 days to increase diversity? You could definitely do it. In fact, a very famous researcher, Derek McFabe, suggested that everyone would do that. Never take the same probiotic for too long of a period of time because you are reducing diversity. I'll never forget Derek bringing that up probably 12 years ago, 14 years ago. Going back to that whole thing, back in the 1990s, back when this was all radical, I was the only dentist going to these meetings, like the international probiotic meetings and all that stuff like that. We had an immunologist who chastised everyone on antibacterial, saying, you have to remember, yeah, you could take a probiotic holiday. In fact, I think everyone, I'm actually on one right now, believe it or not. But just for diversity, and change up your diet all the time just for diversity. Although we did a diversity study, and the greatest diversity was in our, what we call them, the whole food kids. We had the 30 kids that were on the non-processed foods. Let me tell you something coincidental about this. I'm trying to find 30 healthy kids for one of our studies, which was very hard to do. 30 kids who have not been sick and have on no medication. Really hard to find those 30 healthy kids. And when we found one, we always go into this big, examination and diet summary and find that the key thing is they never ate processed food. What % of food eaten by children today is processed? Guys, remember the news release from last week? 70%. Mm-hmm. I know. Mm-hmm. That's where we're getting in trouble. Every day we're getting more and more in trouble because the average adult's at 60%. So we're going the wrong direction. We're all eating all this processed food. They never ate processed food. None of them had any decay either. Of the 30 kids out of the blue zone, only 2 had cavities. I thought that was fascinating too. They don't have the decay. They don't have the issues. They're healthy. Now, what we should do is do an Eve project like what they did in Sweden. And they looked at very healthy individuals. And this is going back to the 80s. They scanned at first. A lot of it had to be done by hand because not everything was entered into the new computers at the time. Okay. Index cards and so on. They scanned the population of Sweden for people who were extremely healthy. And then eventually they got computerized and kept following these people, their diets. What is it that they do that is different? A lot of them came from small towns. A lot of them came from, I never wore the same shoes days in a row. Good idea, Michael. But are you changing the socks? Okay, so anyway, they looked at the health and they followed these Swedes and then eventually got to the point of actually taking fecal samples and then following those fecal samples, worked on first by Tor Medved, who was actually head of the Nobel Committee and a wonderful mentor. I mean, I think the world of Tor. He's a brilliant guy. I have not seen him because of COVID. During COVID, he escaped Stockholm and went up to his hometown area up in Norway, small town. He's 84 at the time, so he's got to be 87. He's not really good at answering emails, so he scares the crap out of me all the time because he doesn't answer email for a long time. But they kept following him for things like cancer and longevity. And these are the people who lived to their 80s and 90s and so on. And they do have their fecal microbiome. And they offered it first. They said, Mark, will be the first person in the United States to get it for research. I was so excited. And COVID came and everything went to heck in the handbasket. But in Europe, they have universal donors. And the universal donors are people who are extremely healthy young individuals, young like wit. Okay. Very young, athletic, muscular. Yeah. Never ill ever. And they would collect their feces and then they would screen it for any pathogen and keep it frozen. And then again, collect it later and keep it frozen. And then again, collect it later and then keep comparing back and forth for any changes, any health changes. And that's how they got all these wonderful studies with fecal transplants in Europe for things like anxiety, depression, OCD, overt disruptive behavior, all the studies on cancer and improving cancer survivability. They got all that stuff going because we never did that. We never did the universal donors. I know we do have a poop bank. I know I donated to the poop bank here in the United States. I don't think it went anywhere. I know it hasn't gained any interest. And I don't even have a deposit slip. Sorry, bad pun there. Anyway, but there's been all sorts of stuff published, as you know, about people doing doping with athletic poop. The poop from Olympic athletes, if you get doped with it, your performance goes up. The Akkermansia studies that were done in Amsterdam, those were just absolutely amazing, where they got all these volunteers to come in and you donated your feces and then you came back, you got feces from someone else. And it was random. So what they found is, they couldn't believe when people volunteered for this too, but they found if you got feces from someone who was young, athletic, and you were overweight and pre-diabetic, you lost weight and your pre-diabetes got much better. All your markers got better. They found all sorts of stuff like that. And aging markers got better if you got something for someone younger. And so that's why there's probably a huge market out there somehow. If we could get the FDA, they finally approved Voust, but that's like $3,500 a capsule, I was told. And you have to take 12 of them. I mean, that's really designed for the Wits and Bill Gates, the worlds.
Yeah. Mm-hmm.
I'm sorry, Whit. But anyway, that's why I see the future, because Akkermansia, hemophilia, seals are leaky gut. And then I mentioned the prebiotic 11 before, a special version of 11. It seals our gut too. Oh, by the way, what produces a lot of 11? Bacillus subtilis, one of the oldest probiotics of all. And, if you ever remember being a freshman in biology and the professor starting off with the Bacillus subtilis story, then that takes you back a long ways, doesn't it? And Bacillus subtilis was discovered in World War II by the Germans because the Africa Corps in 1940 and early 41, the German soldiers in the Africa Corps were having more deaths and injuries from dysentery than from the English. And they saw that their Arab allies, which they had quite a few of, if they started to get sick, would eat camel dung and they would get better. And the German soldiers absolutely would refuse to eat. It had to be warm, fresh camel dung. And Janet's having a lot of fun up there. I'm watching Janet's face and she's cracking up now about it. No shit. I'm not making this up. Okay. And so what they do is they flew a bunch of it back to Germany and looked at it and said, what the heck is in this? And it was Bacillus subtilis. And then they actually isolated it and grew it. And they started with the first probiotic, which was very successful. So, and I know Whit knows this, I know Laura knows this, but for anyone else who doesn't know this, when they decided to move away from antibiotics for chickens. Now, antibiotics, we have found long-term antibiotics in animals was a disaster. As you know, it was good at first because it made them gain weight. And remember, antibiotics make you gain weight. Was gaining weight a good thing? Yeah, think about that. Was that a good thing for these animals be gaining weight? Why you gain weight? A lot of times higher cortisol will make you gain weight. Airway issues can make you gain weight because you're under more stress and the body knows to store more fat. So they were actually stressing the animals all the time. And actually over a period of time, they're starting to show that they were having more issues with the animal herds. And so Europe banned the use of antibiotics in poultry. And so what happened was Tyson Purdue had a fit saying, what are we going to do? We got to give our chickens all these antibiotics, otherwise they're going to get sick. We can't have them in the chicken coop because we pile them all in there. They're all going to die. And someone said, well, what we can do is go back to the old days and give them Bacillus subtilis, a probiotic, And they'll say, well, the dirty secret was they started to use it. It was much cheaper than antibiotics. And guess what? Less illness in the poultry. The chickens were healthier. The egg laying went up. Everything went up. They didn't necessarily gain as much weight. Far fewer chickens had to be sacrificed. That's why they say never buy a chicken. I was told this from some guy. I either worked at Tyson or Purdue. Never buy a chicken that has been parted. Never buy like just legs or breasts or something like that. Never do that, because the parted chickens are the ones that had something wrong with a part of it, and they would part it. That's why they call it parting. They cut it apart, and like they throw away the wings, because like there'd be a cancer on the wings, there'd be a cancer on the legs. They can still sell the rest of the chicken. And so when you buy these prepackaged chickens, never buy a parted one, ever. I never forget hearing those. I swear to God, that's what we did at the plant. You're like, holy cow, thanks for telling me. But anyway, they went down. So like maybe 2 years ago, I was up in Minnesota, the Minnesota State Fair, and they had a big thing from the pork producers up there, the Minnesota pork producers. I asked them, are you guys still using all those antibiotics in pigs? They go, oh, absolutely not. It wasn't necessary. If you feed the pig and give them enough room to roam, they're very healthy. You don't need antibiotics. It's only the CAFOs that use antibiotics. And besides, antibiotics are expensive. They've gone up a lot, haven't they? Antibiotics have gone up. All medications have gone up a lot, pharmaceuticals. And so they said, we don't do it. We don't believe in it. And so the antibiotics are not. Someone asked about if you cook the animal, would the antibiotics be broken down by the cooking process? I really don't know for sure. I know that a lot of the antibiotics are still ending up in people from it, and ending up really badly in the water supply. Stephen Bain did a study on that, on the water contamination by antibiotics, and it was affecting everything in our health system. And so getting the antibiotics out of the cattle and out of the pigs and and a lot of them don't use them at all anymore. And you find there's a big trend not to use it because of the cost. And in fact, it just isn't necessary if you use humanitarian raising. My grandfather was a sustainable farmer, and he was a cattle farmer. And so he would rotate crops and rotate the cattle. And one of the reasons you rotate cattle, Laura, those hooves, they break up soil. They break things up. They put the nitrogen in, but they also put it back in the magnesium. They break apart particles in the soil. So you release, because soil isn't just all fine. There was bigger and smaller particles. He was telling me this back in the 60s and late 50s, how important it was to rotate cattle and alfalfa and corn and wheat. So I grew up that way. Kim, she's from Nebraska, but she's from Omaha, so she wouldn't know anything about this. Right, Kim? You wouldn't know anything about that at all. So that's the story there. And I'm so sorry. I've done all the talking.
No, that's what we wanted, and we've learned so much. I'm just trying to assimilate it all together, Mark.
It was killing time for Tom Neighbors.
I'm sorry, Tom Neighbors actually had to leave the conversation because he had a death in his family.
Oh, no, I'm so sorry.
Yeah, he texted me and said he was going to have to scoot, or he would have participated more. But please, everyone, say a prayer for him.
That's so sad. I'm so sorry to hear that.
Mark, let me ask you a 2-minute question answer, and that is, you have 2 grandchildren coming. I have 1 this week. If you could control their future as far as their health, give us 4 or 5 key things that you would want for them based on what you've been sharing with us.
Well, both of them have been on a prenatal probiotic. Okay, they both have been taking lactobacilli fermentum, which is a very classic one to rebuild. But I also had both of them go on to it's Garden of Eden's, 80 string, 50 billion, just not to take any chances. Try to get back as much as you can, probiotic. I know breastfeeding is going to be very, very important. There's actually a probiotic for breastfeeding too, a Lactia. Oh, by the way, if you want to get some free samples, write down BioGaia, BioGiai. Wait, did I do that backwards? I did BioGaia, right? Yeah. And then you can just call them up and they'll send you free samples. Get the free samples, share the samples with all your patients, with your team members. You can get some samples from ProBioR Pro too. Do that. Get some free samples. Bug try for free samples. They're all available. And then get a good quality when you supplement with a formula. Make sure it's a good quality formula. Stay away from that crap that came out of Michigan. You know, it was just a few months before, maybe 6-8 months before the big disaster out of Michigan and the contaminated formula, that the New York Times did a hit piece on the European formulas. Now remember, you can always have the New York Times do a hit piece for you. They'll do it. They've done it many times in the past. They'll do it for anybody. If you are connected, they'll do a hit piece. So they had this pediatrician who's associated with Dell Children's Hospital, do a hit. And one of the key comments, I love this, these European formulas are not FDA approved. Of course not. They're approved in the EU and the standards are much higher. Don't you love it? I love how people misdirect beautifully. Should have been a politician. Yeah. He should have been a politician. I read that. I laughed so hard because I go like, this stuff is insane. You can't write stuff this good.
I want to share something with everyone as we're kind of wrapping it up here. And this is from Mark. This is an email, as you can see, I received on January 1st, 2020, right during the beginning of COVID. And I want to leave you with this because, Mark, I know we could spend another hour on this, but my little brother, Jim, had a cardiac arrest on Christmas Day, and I flew to Laredo the next day and stayed with him in the ICU. He was totally non-responsive. His pulmonologist arrived and told me he was very emotional about it, that my baby brother died from sleep apnea. The sleep test he was supposed to have done was denied by the insurance carrier, as then, of course, was the CPAP. The pulmonologist told me this was tragic and unnecessary. The CT scan showed that there was massive brain necrotic areas due to oxygen deprivation. Life support was removed, and my brother slowly passed away on comfort care. His journey ended last night at 59 years old. And Mark, I've been devastated by that story, but also so motivated that as part of all the bigger picture of what we're talking about, that we do, as we've mentioned, include, close attention to the airway, which barely anybody is doing. And we know that. I also was very fascinated, and I shared this with Laura and Tom and with Mark and Kim today, that and I know this may be out of focus a little bit, but Inside Dental Hygiene this month, I think it just came out Monday, was a feature article on salivary testing. And so it's an excellent article quoting AOSH and referencing Dr. Tom Neighbors and the things that we've been learning together about salivary testing was highlighted and is now something that is being talked about broadly. So we're really on the front lines of this, and I'm very, very excited about that. And that brings me to where I want to conclude tonight, as we thank Mark profusely, Mark, for the just incredible amount of information that you shared with us, and for being with us at the symposium last month, which we're going to do every year. But we have coming up next, as you look at our agenda for this year, we will have coming out, actually, that should be July 1st. We will have coming out our foundation seminar, which will be online. So be looking starting June 17th. We're going to be doing a pre-sale sale where we're going to reduce the cost of that online seminar by 25% until the 4th of July. and then it'll be coming out and it'll be the full price. You'll receive after that 10% off as a member of the study club. But I also want to bring to your attention down at the bottom of the page here, the AOSH National Meeting, that a live event, which will be in Orlando, September 7th through 9th. And, you know, we failed to say, Mark, that you're serving this year as president of AOSH, and congratulations and thank you for that. That's
well, don't forget, you've done that too. More than once.
Well, anyway, only to say I know how much work it is, and thank you for that. But also, we're going to have a fabulous meeting, and our IDM Scholar Society is intimately involved with AOSH. AOSH is our home base, and we're just kind of expanding off of the model that we've learned there.
And don't forget, I'm so sorry, I didn't want you to forget, we have the regional meeting in Dallas. August 24th, I think.
Yes, that's right. And we'll be there together. We'll be there together, and with many other colleagues that'll be sharing on that day. If you're in that area of Dallas or want to come be with us, please look that up on the AOSH website. So we've got a foundation seminar coming up. We'll be marketing to you in another week or two. And then the AOSH meeting will be all there together in September. Tom will be there, Laura will be there, Gina will be there, I'll be there, and of course, Mark will be leading. And so that's it for tonight. I want to thank you all for being with us. And we look forward to being together in 2 months. So this is June. So we'll be meeting again in August. And we look forward to that. And meanwhile, have a tremendous summer. And thank you so much for being part of this revolution that we're all part of together in changing healthcare through dental medicine and the things that we can do. So thank you so much, Laura, and Mark. Thank you so much, my dear friend. We appreciate you so much. And thank you, everyone, for participating tonight. And we look forward to seeing y'all soon. So have a great evening.
Good night, everyone. Thank you so much. Thanks for having me.
Thank you. Good night.
Night.